Hi, Shantel. This is my response to your discussion post. So, I also went with step six in the recovery process. And while I do feel that all of the steps are vital in the recovery process, step six was the one that really resonated with me the most, due to the fact that these steps require one to give themselves over to God completely and to allow Him to help them understand that change is necessary to progress and to overcome addiction. Step six is not just where somebody will say, "Oh, I'll stop using," or they'll just stop and they'll eventually go back. It's when the person is really ready and willing to make a complete change and is willing to address the reasons they're unable to change before and what they should do to change the addictive behavior. On the Alcoholics Anonymous website, it's discussed how step six builds upon the work that was done in step four and step five, which helps them to identify behaviors and prepare for the change that's to come with step six. Choosing the setting of inpatient treatment programs of an inpatient treatment program to integrate step six allows the client to experience the withdrawal symptoms and to deal without the added temptation of using again, which may give them the strength that they would need to recognize and accept that they need a change and help them to feel that they're ready to give themselves over to their higher power so that their faults can be changed. Without temptation or access to substances, which, as you said, are distractions, they are able to see the bigger picture. Although I chose an outpatient setting to integrate step six with treatment, Donovan et al. Stated that many people who attend 12 step programs in outpatient settings often fluctuate in their readiness and their commitment to change. So, an inpatient setting sounds like it might be a little more appropriate to implement and integrate step six with treatment. Communication is actually an important factor, which you brought up. It's important because it focus on during the process, because communication about behaviors and communication about their addiction, they can discuss this and how it's affected them and how it's affected other, and it can give them the chance to really reflect on their actions. And effective communication between the client and the provider, it helps them to invoke change talk, which I believe is vital in step six of the recovery process.